Our next skill is preparing medications from a vial. For this skill, I'm going to have you guys reconstitute. So I'm going to give you I'll end up giving you a math problem. You got to figure out how much to reconstitute with and how much you're going to be giving. So I'm going to go through, this medication is cefazolin, 500 milligrams per vial. It could come in 1,000. Just know you got to do with whatever your pharmacy has. The doctor ordered 300 milligrams. So there's a couple ways that you can figure out how much you're going to be giving. Let's go ahead and read this bottom part here first. So for reconstitution, for IM, add 2 mLs of sterile water for injection. Note that for some medication, they might use lidocaine, they might use sterile normal saline, but for this one, it says sterile water. It says shake well. I usually don't shake, I usually roll till all the contents are dissolved. And provides approximate volume of 2.2 mLs. So when you pull up this whole medication in a vial, it's going to be 2.2, when you pull it up into a syringe, it's going to be 2.2 mLs. And note that 225 milligrams is in 1 ml. So this is the math part we're going to use. We're going to use the 225 milligrams per ml to figure out how much we're going to be giving, how much we're going to pull up. There's 3 ways to do this. Okay, there's ordered over half times what you have in mLs. So ordered is 300 milligrams. So 300 divided by 225, which you have, times what you have in mLs. So it was 225 and 1 ml. I got 1.3. This is 2 other ways that you can do it using algebraic equations. 225 is to 1 ml, 300 is to x. Then you multiply 300 times 1 and then divide it by 225. And that's how you get 1.3 mLs. Or you can cross multiply. This is another way. 225 milligrams is in 1 ml, 300 is to x, and then we cross multiply and get 1.3. Okay, so again, we're going to come up over here. We're going to add 2 mLs of sterile water for our injection. So let me just flip this around. Let me just show you needle sizes real quick before we start. Note that the length is the length, but the gauge is how big these needles are. So as you see, the 18 gauge is a much thicker needle. That's not really what you would give an injection with, but it is medication, for pulling up medication, it's useful. So anywhere from a 22, okay, to about a 25, that's your thinnest. Actually goes to 27 is your thinnest. So anywhere from a 22 to a 25, depending on the viscosity of the medication. I usually use a 22 when I'm pulling up medication. It's a little bit more, the needle's a little firmer and less flimsy. So as you get thinner there, it becomes a little flimsy. So for IM injections, we're running around a 22, 21, 22, or even a 23. So here's my sterile water, because it said to mix with sterile water. And here's my medication that I pulled up. This is going to be a powder for you guys. Once you inject your fluid in there, it's going to be a liquid, which I already practiced once, so it's a liquid now. But you're going to have a powder in there. I'll give you a math problem to figure out. You're going to need your syringe with your needle on it. If it doesn't come with a needle, you're just going to grab a syringe with a separate needle. This is a 21 gauge. 21 gauge, so that's fine to give it. It's a 1 inch. So 1 inch would be more for a thinner muscle like a deltoid. For ventrogluteal, I'd want probably at least a 1.5. And this is an 18 gauge. So 18 gauge 1.5. So blurry. Can you see it? No. All right, 18 gauge 1.5. That would be for pulling up medication, not for giving, okay? Your really thick medications like penicillin, you might be ending up using probably a 22, maybe sometimes even. They have 20s or an 18 because it's so thick. Anyway, let me flip over. Enough talking. Let's go ahead and go to, so my hands are washed. I'm in the bedroom doing my 3 safety checks as I'm pulling this medication out. Pulling out, making sure I got the right medication against the Pyxis, taking it out and comparing it to the MAR, and my third check will be at my bedside. Again, also making sure I got sterile water, and I confirmed it with what's on your label. This label, you know, it's big. It would be around your vial, and you would read how much you're going to be giving. So we already did our math. We know we're going to pull up a total of 1.3 mLs here, and we need to mix. It says to add 2 mLs of sterile water. So, okay, so I'm not going to use this needle. I'm going to keep it in my wrapper. I am going to use this needle to pull up the medications. Okay, I'm wiping the tops of my bottles. All right, 2 mLs. So you need to put air in first. 2 mLs of air. 2 mLs of air. And then pull up your fluid. And it should come right out. You might have to assist a little bit with your finger to pull it down. And go with exactly 2, don't go more or less. Okay. Ready, wipe this one. I'm gonna put my 2 mLs in here. Okay. I am gonna have to reuse this to pull the medication up, and then we'll change needles. So one-handed and scoop. I like to keep it in my plastic wrapper. I'm gonna roll this in my hands, wait for it to dissolve. Usually what I do is I'll read how much to mix it with, and then let it dissolve, do my math, and then come back and it's dissolved and ready to go, just for a time saver. But anyway, it is fully dissolved. There's no sediment left. There's no clumps. It's a yellow color. I'm gonna get a clean alcohol wipe. Okay, clean alcohol wipe, wipe my top again. Now I'm gonna pull up, our math said 1.3 mLs. So again, I'm gonna put 1.3 of air into my vial. Okay, like this nice steady surface as I'm poking it in. Make sure your needle stays in your liquid. If you're getting air, push it back in. Make sure the needle is in the liquid, not above the liquid, otherwise you'll just get air. And I got 1.3. Looking for any air bubbles. So if you're getting a lot of air bubbles, you can flick this and then squirt it back up. So I don't have any air bubbles. Let's see, okay. Now I'm just going to, what I can do is use this safety thing and take off my needle, but I need to keep this for testing purposes. So I'm gonna one-handedly scoop and take off my needle. Get it off to the side. I'm gonna use this, let's say we have a thinner patient, maybe a female that's really thin, or an elderly person, we could do the 1 ml.